Hi and welcome back. Today we're discussing diabetic considerations in exercise. There are two main types of diabetes. Type 1 is caused by total or near total destruction of insulin secreting beta cells in the pancreas. Insulin production is lost and the hormone has to be injected regularly in order to control blood glucose levels. Type 2 diabetes is characterized by insulin resistance. Insulin is produced by the pancreas, but it becomes less and less effective at promoting the entry of glucose into muscle cells and adipose tissue. Type 2 diabetes is commonly found in overweight and obese individuals whose body fat is distributed centrally like an apple shape. In addition to coronary heart disease, the health risks that diabetic individuals are most predisposed to are kidney disease, peripheral vascular disease, retinopathy, which is damage to the retina of the eye, peripheral neuropathy, which is damage to the nerves, leading to loss of sensation and weakness, and autonomic neuropathy, with possible side effects on heart rate, blood pressure responses. Other considerations are hypoglycemia episodes, which are not uncommon in exercise classes. Symptoms include being shaky, weak, confused, anxious, sweaty, and sometimes aggressiveness. You may feel dazed and your movements may become less coordinated. Most of you with diabetes know how you respond when blood glucose levels are too low. Hypoglycemia is less likely to occur if blood glucose levels are checked twice, so once 30 minutes before exercise and once again immediately before exercising. And 20 to 30 grams of additional carbohydrates should be ingested if pre-exercise blood glucose is less than 5.5 millimoles. If new to exercise or increasing the intensity or duration of exercise sessions, levels should be checked every 30 minutes during exercise, although that's dependent upon the size of the individual and the intensity of the exercise. 1 hour of moderate intensity exercise will generate or require about 15 grams of extra carbohydrate before or during exercise. After exercise, blood glucose levels are checked again, at least twice, to ensure that hypoglycemia is not developing. Those on insulin medication can experience induced hyperglycemia, i.e. a rise in blood glucose levels when they commence exercise. This is because exercise triggers a release of glycogen stored in the liver, and so blood glucose levels rise. However, if the insulin levels are inadequate, glucose cannot be made available to the muscles, and so levels continue to rise. Exercise should not be commenced if pre-existing exercise blood glucose levels are more than 13 millimoles. If glucose levels pre-exercise are more than 10 millimoles, check again 10 minutes after starting exercise, and only continue to exercise if the level has fallen. Autonomic neuropathy may lead to abnormal heart rate and blood pressure responses. Peripheral neuropathy highlights the need for good foot care. You should check your feet before and after exercise, as you may be unaware of blisters, so it's a good idea to wear soft sole, comfortable shoes. For those with a lack of sensation in your hands, means that you may get soft dumbbells that have hand straps for safety. Please use these recommendations to keep you safe when exercising.